Uh, our topic today, inshallah, will be about the imaging of the female reproductive system, in which, inshallah, we are going to start with the introduction to explain the imaging modalities that used for evaluation of this system, which include ultrasound, which is the most commonest imaging examination that done frequently for assessment of this system, plain X-ray and fluoroscopy, CT scan, MRI, and angiography. These are the imaging modalities that uh, play a very important role in assessment and evaluation of this system. We start with the first one and the most common imaging examination that used for assessment of this female reproductive system, which is ultrasound. Ultrasound is the very commonest imaging modality that used for assessment of this system. All of you know that the ultrasound uh, may be done with two techniques. The first one is called transabdominal ultrasound. You look to the probe on the patient, on the operator hand. The probe or transducer is put on the anterior abdominal wall of the patient. So it's called transabdominal ultrasound. The operator put the transducer in the pelvis to look for the female reproductive system, to look for the uh, uterus and the ovaries and the vagina. And the other technique, also ultrasound technique, is transvaginal. Transvaginal ultrasound. Also, this is a probe. Look to the probe in this technique. The probe is designed to be fit to this, to be inserted through the vagina. So this is transvaginal ultrasound. Also, this is a probe or transducer, and this is a probe. And this probe should be inserted through the vagina to assess the uterus and the fallopian and the ovaries and the all other pelvic structure. This is a urea bladder, which is located anterior to the uterus. Posterior to the uterus is the rectum, and this is the pouch of Douglas, or called the sac, but very important region. And this is the ovary, which is connected to the uterus through the uterine tube or fallopian tube. Look to the urea bladder. The urea bladder is empty. So, to assess the uterus by the transvaginal probe, the patient should empty her bladder. But in transabdominal ultrasound, the bladder should be full like this, because we need this urine in the urinary bladder to be used as a window to look for the uterus and ovary. So in transabdominal ultrasound, the patient should retain urine, but in the transvaginal, the patient should evacuate. The patient should evacuate her urinary bladder. So these are the techniques, ultrasound technique for assessment of the um, uh, female reproductive system, including uterus and ovary. The quality of the image of the transvaginal ultrasound is better than transabdominal. The resolution is better in transvaginal. You can see the more details by the transvaginal ultrasound more than in transabdominal ultrasound. So this is a transabdominal ultrasound. When you see the urea bladder full with urine, this indicating that this is a transabdominal ultrasound. So this is a transabdominal ultrasound. This is a urea bladder containing urine, and this is the uterus. This is the vagina, and this is cervix, and this is the body of the uterus, and this is the fundus. This is the sagittal or longitudinal section. This is the endometrium. This is the endometrium. This is a longitudinal or sagittal plane. And in the axial plane, like this, you can see the both ovary, left ovary on the left side and right ovary on the right. And in between, you can see the uterus with endometrium in the center. Endometrium, look, the endometrium is hyperechoic, but the myometrium is intermediate to hypoechoic. But the endometrium is usually seen as a hyperechogenicity in the center of the uterus. So this is the anatomy. So the myometrium is of low echoes or intermediate echoes, but the endometrium is echogenic or hyperechoic. This is a transvaginal ultrasound. There is no urine in the urea bladder, so this is a transvaginal ultrasound. You can see also the uterus. This is the fundus of the uterus, and this is the body. In the center, this is the endometrium. Endometrium appear hyperechoic or echogenic stripe or linear stripe. This in postmenopausal women, this endometrium thickening should be less than 5. If it is more than 5 millimeter, it's considered abnormal. And in this case, you have to exclude the endometrial carcinoma. So, because in the postmenopausal women that present with vaginal bleeding, you have to exclude endometrial carcinoma. But although the endometrium hyperplasia is most common, but you have to exclude this postmenopausal. This is a endometrial carcinoma, which is suspected if the endometrium thickening. You have to measure the thickness of the endometrium. If it is more than 5 millimeter, it's considered abnormal, and you have to exclude the endometrial carcinoma by further evaluation. You can take a biopsy, D&C, from the endometrium for to exclude this endometrial carcinoma. This is a normal ovary by transvaginal ultrasound. Look to the normal ovary in the center. This is the follicles arranged in the periphery. This is the follicles, which the diameter of this follicle range between 3 to 4 millimeter. Range in periphery of the يعني كله ده هو الأوفري. In the center, this is the stroma, which is the central. The stroma appear hyperechoic, echogenic. The center part of the ovary is called the stroma, which is hyperechoic. And look to the follicles arranged in the periphery, and usually the diameter of these ovaries, of these follicles, range between 3 to 4 millimeter. Look to this normal appearance to compare it with abnormal appearance of the ovary. This is the left ovary and this is the right ovary by the transvaginal ultrasound. طيب احنا عارفين انه what is the first sign of pregnancy? What is the sign? What sign?
Amenorrhea.
Yes, amenorrhea. If the patient is complaining of amenorrhea, you have this is raising the possibility of pregnancy. How to confirm this is pregnancy or not? What can
Beta HCG?
Yes, HCG from the serum, or can be done for assessment of this pregnancy. And also you can confirm this pregnancy by the ultrasound. Why we use ultrasound and we do not use other like CT or X-ray or other?
Non-ionizing radiation.
That's because it is non-ionizing tools or examination. So you have to assess this patient by the ultrasound. It is better to do transvaginal for the early pregnancy. Transvaginal ultrasound is more sensitive. طيب, what is the first sign of sonographic sign of pregnancy. يعني what are the signs of pregnancy in the early stage of pregnancy? What do you see?
Maybe yolk sac or
Yolk sac. Yolk sac seen.
is it too small to be seen?
You can see yolk sac, but before the yolk sac, what would be seen before the yolk sac? You can see this, which is called gestational sac. This is a gestational sac, which is anechoic. This is a circular structure, anechoic. هو اسمها ايش؟ gestational sac, anechoic circular structure with surrounding hyperechoic areas. يعني هي in the center this is بيسموها شنو؟ gestational sac and surrounded by hyperechogenic ring. This is the called شنو؟ gestational sac. This gestational sac usually seen at the 4 to 5 weeks by transvaginal ultrasound. يعني إذا عملنا transvaginal ultrasound this will be seen at 4 to 5 weeks. But if we do transabdominal ultrasound, it is usually seen at 6 weeks. So the transvaginal is more sensitive. يعني you can detect this gestational sac earlier, about 4 to 5 weeks. But by transabdominal ultrasound, it detected at 6 weeks of gestational age. لذلك احنا دائما we prefer شنو transvaginal to detect this gestational sac early. طيب قبل شويه قال يولك sac. This is a yolk sac. يعني اذا كله ده هي gestational sac, and there is a smaller one within the gestational sac. This is called yolk sac. إذا الإيكوجينيك ring with anechoic center ده هو اسمه شنو gestational sac. Within the gestational sac في other ring. This is شنو yolk sac. And then you can see شنو the embryo. يعني مثلا this is the embryo. يعني أول شيء إذا بنشوف شنو yolk gestational sac, then yolk sac, and then the embryo. طبعا احنا مهم جدا احنا to assess شنو the gestational age. نعرف عمر الحمل ده كم gestational age. In this stage, in the early stage, you can assess or can estimate the gestational age by the gestation mean sac diameter. بنعمل measurement for the gestational sac in 3 diameter. نعمل width, length, and height of the gestational sac, and the machine calculates these distances into gestational age. يعني انت ما عليك الا تعمل measurement. مثلا هنا من شوف الميجرمنت من هنا اللينكس كان كم مثلا والهايت كان كم. الميجرمنت الجهاز لحاله بيعطيك انه والله يقول لك this is the gestation age is 6 weeks. So this is the first method of assessment or estimation of gestation age, which is called mean sac diameter. طيب بعد ذاك بيحصل development of the fetus and increasing يعني develop and increase and growth and increasing the size like this. In this time you can assess or estimate the gestational age by other method which is called crown rum length. يعني إذا هنا كان عملنا mean sac diameter when uh, the pregnancy develop and increase the size of the embryo. You can estimate the gestational age by the measuring of the crown from the top of the head to the buttock, and this is called crown rum length. This is called crown rum length, and this crown rum length is the most يعني accurate one. يعني near to the يعني إذا كانت واحدة مثلا عندها uncertain of date يعني يعني she does not know when her last menstrual period. احنا دايما we depend on this one. crown rumblings هي more accurate than the others method. فإذا هنا this is called uh, crown rumblings. زي ما قال هنا an intrauterine pregnancy gestation sac can be seen about 5 to 6 weeks, but the yolk sac because this I usually see next to the gestation sac within the uterus. طيب بعد ذلك بيحصل development of the fetus and all the organs may be يعني develop, and then there are other methods to assess or to estimate the gestation sac. This is the biparietal diameter usually done in the second trimester. Second trimester, you can assess the estimate the gestation sac by the biparietal. You can also measure put the cursor in this the outer table to the inner table. يعني دائما نعمل measurement من outer table to inner table with the line passing through the the salami and should be perpendicular to the the fissure intermediate fissure دي. فنعمل measurement. Also the machine calculate this measurement and give it as the weeks. هتقول لك انه the gestational age is مثلا 27 weeks. Also you can estimate the gestational age by other method. They can be done in the second and also in the third. اللي هي شنو؟ also biparietal can be done in the third. In the second and third trimester, you can assess the estimated gestation sac by the femur length. This is the femur of the fetus. You can put the cursor in this in the end and the other in the end and measuring the distance. This is called femur length. Also, the machine calculates this measurement into weeks. تقول لك مثلا this is a 32 weeks gestational age. فإذا this is a gestational biparietal diameter and this is a femur length. Also you can عندنا حاجة اسمها شنو head circumference. Also is the other method. يعني ممكن نعمل شنو measurement of the circumference of the head. Also this is other method of assessment or estimation of gestational age. Also can be done in the second and third trimester. طيب عرفنا in the first trimester and then second and third trimester. طبعا في other abdominal circumference also can be done, and this abdominal circumference يعني he help us in the estimation of the weight of the fetus يعني أكثر من gestational age. طيب عندنا حاجة اسمها fetal well being can be assessed by ultrasound. حاجة اسمها by physical profile. بنعمل assessment of the إذا كان حسينا البيشنت البريجنسي في distress in the fetal distress او كان في هاي ريسك بريجنسي you can assess the fetal well being by حاجه اسمها biophysical profile which is done by عندنا يعني about 4 or 5 measurement. You have to calculate the amniotic fluid نشوف how much. عندنا طريقه معينه نعرف انه الامنيوتيك فلويد يزيد normal amount or decrease. بنعمل calculation بنشوف how much is it amniotic fluid. This is amniotic fluid. And also you can assess the movement of the body. يعني this usually done يعني within 30 minutes كده بنعمل scan نشوف ال movement of the body is it يعني normal or decreased movement of the body. And you can look to the limbs extension and flexion, the upper and lower limbs. كل واحدة عندها point معينة. والrespiratory rate you can see the respiratory assess the respiratory. أي واحدة عندها point معينة بنعمل لها summation ونشوف هل is it within normal or not. This is called fetal well-being اللي هي بيسموها by physical profile. This is the yes. And also this is the back of the fetus. This is the spine, and this is the buttock. This is the lower limb, and this is the upper limb. You can see the finger, the mouth, the nose, the head, this is the chest, and the ribs, abdomen, lower limb. This is the ultrasound for the pregnancy. Also by ultrasound you can assess the placenta. Placenta, very important to assess placenta. This placenta is easily evaluated by ultrasound and also can be assessed by MRI. Like usually we assess it by the ultrasound. This placenta by the 9th weeks is seen as well-defined intrauterine structure. By the 9th week, you can see the placenta as well-defined intrauterine structure. Lining the inner wall, بنشوفها شنو adherent to the inner wall of a portion of the uterine cavity. But this is the fetus, and this is the amniotic fluid, and this is the placenta, which is lining the inner wall. And it is very important to look to the lower edge of the placenta, and also to look for the size of the placenta, and if there is a separation of the placenta from the wall, and if there is a calcification, all this should be assessed. Abnormality related to placenta can be easily diagnosed by ultrasound, such as مثلا abruptio placentae or placental hemorrhage. عندنا placental hemorrhage, separation of the placenta from the uterus, or placenta previa. What is a placenta previa? Placenta previa. Anyone? Any volunteer?
Sure.
Placenta previa. Placenta previa. طيب احنا عندنا the placenta lower edge. احنا طبعا عارفين عندنا شنو الفندس in the upper and in the lower part بيكون عندنا السيرفيس وزي the vagina. Normally in the normal person the placenta normally seen in the fundus. لكن إذا كانت low down and reaching the cervix, it may cover the cervix completely or partially. So placenta previa in يعني characterized by low-lying placenta that covering the internal os. فحتى عندنا منها complete and partial placenta previa. So placenta remains position over the lower uterine segment after the 36 week of pregnancy. دي بنسميها placenta previa. يعني ينزل البلاسنتا تكون low lying placenta وعندنا لها degree. This is abnormal position placenta بسموها placenta previa. So the placenta normal should be in the fundus, يعني بسموها fundal placenta, or in the upper part of the uterus. This is هسه الآن عندنا placental imaging. This is the placenta seen on the sagittal view at the 18 weeks. This is a normal placenta. Also ultrasound. الآن كلنا قاعدين نتكلم على ultrasound. The role of ultrasound assessment of the reproductive system, female reproductive system. Intrauterine contraceptive device may be ممكن يحصل له شنو أحيانا. Normally المفروض يكون in the endometrium, inserted for family planning, and this IUCD sometimes may be lost. ممكن أحيانا بيحصل له migration. يعني كان يعني perforate the uterus, could be located in the abdomen, and also in abnormal position. So you have to search for this IUCD or IUD, intrauterine contraceptive device. The lost intrauterine contraceptive device here, although it is not common problem, but should be لذلك should be شنو assessed by ultrasound fairly. يعني أي IUCD lost, the ultrasound should be done fairly. طيب how to describe this IUCD? Can a volunteer to describe this IUCD?
Hyperechoic.
Yes, it is a hyperechoic linear. لاحظوا هو شنو linear، هو نفس الشيء بتاع شنو اللي IUCD. فهو أهم شيء زي ما قلت hyperechoic، يعني highly reflective or hyperechoic، يعني structure اللي هو بكون linear within the normally seen in the endometrial cavity. طيب
Doctor,
yes,
are both images here transvaginal?
yes, both images are transvaginal. Yes. طيب if the ultrasound fail to identify this IUCD, what next imaging technique be done?
CT.
CT.
CT. Is there any other option?
X-ray.
X-ray. طبعا هي سي تي كان ديمونستريت، لكن نحن دائما بنراعي للشنو؟ للكوست افكتيف. يعني if the X-ray can يعني can help us in identifying the problem, no need to do the most the expensive technique. So the next option is plain film, plain radiograph for the abdomen to assess the ICD. What is this examination?
Plain X-ray.
Ultrasound.
Plain X-ray.
Yes, or X-ray or plain X-ray or radiograph, abdominal radiograph. You can see this IUCD in the pelvis. How to describe this IUCD?
Opaque.
Hyperdense.
Yes. Hyperdense, but it's better to see opaque. Yes, it's opaque structure. Or yeah, also hyperdense, it may be, it is right. يعني. لكن we prefer the opacity more than density, and in the density يعني usually seen usually used in the CT. لكن all you are right, it is hyperdense or dense structure or opaque structure. طيب the next technique is hysterosalpingiography, HSG. This HSG, what is HSG?
What's the question?
What يعني give me any information that
Like hystero is the uterus, salpinx is the fallopian tubes.
طيب okay, how this technique perform?
Contrast through
Yes.
the
Yeah.
uterus.
Through the cervical canal.
Yes, we need a contrast in the searing. This contrast يعني احنا بيكون عندنا contrast in the searing. This and connected to the cannula and شنو contrast, and then we put this cannula in the patient should be أول شنو in the lithotomy position, and we put this cannula in the in the cervix, and then we push the contrast. The contrast pass through the cervix, then filling the the uterine cavity, and then what?
and then the fallopian tubes.
Fallopian tube, and then
The abdominal cavity.
why abdominal cavity? You are right, but why?
Because they're open, يعني
Yes,
not blind, and
because the fallopian tube or uterine tube are freely open. يعني distal part بتاعتها تكون freely open, not connected to others. So the contrast then pass freely in the peritoneal cavity. This is the normal. Say the patient is put in this position and under septic condition, the patient should be well centered, and the contrast injected through the uterine os, the contrast filling the uterus and then the fallopian tube. The indications, there are many indications. The most important is infertility, which is the most common indication, and to assess the recurrent miscarriages, and in case of congenital uterine anomalies or uterine مثلا blocks or blockage uterine tube pathologies, أو all these are indication, and there are other indications. The contraindication include the current patient عنده recent any surgery recent, or if there is a severe pelvic inflammatory disease, acute or subacute, and the most important is pregnancy. So you have to exclude pregnancy by HCG, serum HCG or urine pregnancy test, and also you can do ultrasound. but لكن الوقت ده بيكون غالي وما يكون لسه عندنا ممكن يكون عندنا يعني evidence of pregnancy by ultrasound. لذلك نحن we prefer to do شنو HCG especially the serum. Complication is that is very rare, pain, bleeding, very rare infection and contrast reaction. This is a طيب لذلك احنا قلنا we put the cannula. This is a cannula. Tip of the cannula put in the uterine os and we inject the contrast filling the uterine cavity, then the fallopian tube, and if there is the fallopian tube are normal, the contrast filling the peritoneal cavity بيكون حصل له spill بيسموه يتدفق على peritoneal cavity. This is the normal. So you can see to report this HSG هنقول إنه the normal uterine cavity with normal ossification of uterine cavity with and fallopian tubes also normally ossified with free peritoneal spill of contrast. Free peritoneal spill of contrast. This meaning there is no filling defect in the uterus and the fallopian tubes are patent, not blocked with free peritoneal spill. كل اللي شايفه ده contrast متدفق من the distal part of the fallopian tube because it is open. In this one, you can see also this is normal uterus and the both fallopian tubes in both sides are normal. But in this one, what abnormality do you see? Yes. How about the uterus? Is it normal or abnormal?
Normal.
Normal uterus. How about the fallopian tubes? Right and left?
Maybe
normal.
abnormal.
طيب normal till نقول هنا. But in the distal part
Dilated.
dilated. Why the fallopian tubes? These fallopian tubes are dilated. ليش هي dilated؟ هي صح you are right. They are dilated. تفتكر ليش؟ Why؟
Same.
Yes. طيب الكونتراست هو اصلا جاي من السيرفيس بعد ما حصل feeling to the uterine cavity.
Inflammation.
طيب عمل ايش الانفلاميشن؟ طيب
Weakening of the wall or stenosis.
blockage ممكن نسوي blockage.
Yes, blockage. ايش عرفنا كيف في blockage؟
distally.
Yes, distally blockage. ليه
block.
blocked؟ ليه عرفنا كيف how do you know that it is blocked أو both are blocked؟
لأنه doesn't go to the peritoneal cavity.
Yes, there is no spill. This is هنا there is no freely spill. But here there is no spill. And also إذا هي مسكرة هنا أكيد الكونتراست ده ما حيقدر to pass لابد يحصل dilatation. فعشان كده هي بقت dilated لأنه مسكرة. فإذا هنا هي blocked here. There is no free spill of contrast and the fallopian tube is dilated. طيب if the fallopian tube is dilated بيسميها ايش؟ The term used for description of dilated fallopian tube
Hydrosalpinx.
ده bilateral hydrosalpinx اللي هي عندنا إذا bilateral blockage of the fallopian tube with hydrosalpinx and no spill of contrast, no spill peritoneal spill of contrast. ما في أي contrast متدفق. ليش؟ لأنها هي blocked. طيب كده نجي لأذر تكنيك CT يعني can be used for the assessment of the female pelvis لكن for شنو non pregnant women. لكن إذا كان pregnant ultrasound. This is a CT for the pelvis. This is a posterior, this is anterior, this is left, and this is right. For orientation, usually this is left and this is right, this is posterior, and this is anterior. So what is this?
Urinary bladder.
And what is this?
Cervix. Or uterus.
Uterus. And what is this?
Rectum?
Rectum, yes, and this is the also uterus, and this is a left ovary, right ovary. But so this is this is CT done at the level of the uterus to demonstrate this uterus and the you know الاوفري. طيب احنا عارفين what is this؟ ايش ده؟
Ovaries.
هي دي كله كده ايش؟
Contrast.
what is this؟
okay. Fallopian tubes.
fallopian tube. why fallopian tube؟ طيب هي في ايش الاستراكشر دي موجود فيها ايش؟
Contrast.
Contrast.
So what is this? This is the bowel loops. Bowel.
Okay.
This patient receive which type of contrast? IV or oral?
Oral.
Oral. لذلك احنا مهم جدا نحكي البيشنت oral contrast. ليش؟ لأنه this help us in differentiation between the bowel الاناتومي كله، حتى إذا مثلا الأوفري والأدينكسيا تكون شنو؟ كلها of soft tissue density. لذلك بيكون في difficulty to differentiate between the bowel and the ovary and adnexia in generally. So for proper assessment of the female pelvic structure, the patient should receive oral contrast to highlight this, or to enhance this, bowel to be easily differentiated from the other, structure. So this is very important. What is this technique?
MRI.
MRI, which plane?
Sagittal.
And which sequences? Which sequence?
T2.
T2.
T2, yes, sagittal T2 MRI. What is this structure?
Urinary bladder.
Yeah, and what is this?
The uterus.
And what is this?
Spine. Rectum.
Yes, rectum. Rectum is posterior to the. So this is the endometrium. أهم شيء look to the endometrium. How the endometrium appear? Endometrium appear hyper. Yes.
Tense.
Yes, hyper intense or high signal. Endometrium is appear of high signal or hyper intense. But this is the endometrium, and this is the cervix, and this is the vagina. In this sagittal MRI T2. طيب اتكلمنا كده introduction على التكنيكس. Now we are going to discuss some abnormality. We start with congenital anomalies. So this is the first one is arcuate uterus. Arcuate uterus, which is characterized by mild indentation. Look to the fundus. يعني لاحظوا الفندس بيكون شنو؟ يعني like this.
The breast.
Yes, the breasts or indented or the breast, but there is a mild indentation of the endometrium as the uterine cavity. But so this is HSG. You can see the uterine cavity is normally specified by contrast. يعني there is no Philip defect. كل حصل specification. contrast ده غطى لنا كل الكافيتي. And you can see this the uterine canal, single uterine canal. The shape of the uterus بيسموه broad saddle shape with a smooth indentation. With a smooth indentation. الاندنتيشن ده قال usually less than 1 centimeter. ولاحظ انه قال شنو transverse diameter of the uterine cavity increase. فبنلقى انه also in the arcuate uterus. يعني عندنا فيتشر معين. اول شيء يكون عندنا indentation او زي ما قالت depressed الفندس with less than 1 centimeter يكون الديبريشن دي. there is increased transverse diameter of the uterine cavity. يعني إذا look to this transverse uterine cavity and compare it with any مثلا دي. هنا حصل شنو؟ increase in transverse diameter of the uterine cavity. So this is called arcuate uterus. The next congenital is look to this HSG. You can see there is a 2 horns. The horns and this is the horn. Between the two horns, what about the angle between the two horns? Is it acute or obtuse angle?
Acute.
This is acute angle. But so look to the angle between the two horns. If the angle is less than 75 degree between the two horns, this is a highly suggestive of septate uterus. فسو septate uterus نحن بنقول septate uterus كيف؟ لأنه الكونجنتال دي بتشبه بعض. فإحنا you look to the شنو the angle between the two horns. فإف it is less than 75 degree, this is a goes with septate uterus. لكن if the angle is more like this, obtuse angle more than 100. لاحظوا الانجل هنا بقت كبيرة بين التو horns. This is the first horn and this is the second horn. The angle is more than 105. This is a most likely to be bicornuate uterus. Is a bicornuate uterus characterized by obtuse angle more than 105 degree. But septate uterus characterized by acute angle usually less than 75 degree. ثاني عندنا congenital. other congenital is unicornuate one which is characterized by one horn. This is due to failure of Mullerian ducts during the development. Look to this HSG. You can see this, there is only one horn. The endometrial cavity usually بيكون شكله كيف؟ بيسموه فيوزيفورم، يعني مغزلي زي ما بيقولوا فيوزيفورم تابرينج از ذا ايبكس. لاحظوا الايبكس يعني هو بيكون مغزلي كده، وفي الايبكس بيكون يحصل له تابرينج يعني كانه جت سمولر يعني. and there is only one fallopian tube. ما بيكون عندنا two fallopian tubes. يعني اذا ال end دي connected to one fallopian tube. فthis is the unicornuate uterus and one horns, one fallopian tube, and usually there is a shifted off midline. لاحظوا انه بيكون towards the left or the right، يعني ما بيكون in the center. This is one horn usually تكون shifted off, not in the center. Sometimes from shifted to the right and sometimes shifted to the left, but it is not in the center. طيب what other imaging technique can help us in assessment of this congenital, and it is a gold standard. يعني هي الآن بقت more better than the HSG. تفتكروا what?
MRI.
Yes, MRI. So MRI يعني هو الآن بقى more more informative يعني gold standard for this congenital anatomy. This is MRI axial. You can see this is the rectum and this is the uterus. And the endometrial cavity is divided into two compartments by the septum. يعني عندنا two compartment. Between them there is a septum. This is a septate uterus. Septate uterus. طبعا ممكن تشوف السكشن الفوق له والتحته. You can follow this and you هتشوف الانجل وكذا، لكن هسه دي one section. فالمهم عندنا separated to compartment by this septum in between. And what is this what is this plane? This is MRI also. Which plane is this? Is it axial like this?
No.
Look to this. Is it axial? This one?
Frontal or
Yes, بيسموها
coronal.
Yes, ايوه معناته coronal. يعني ده كأنه انت زي ما قلت انت if you are يعني assume that you are looking to from front تعرف ان this is شنو coronal. This is the left مثلا femur and this is the right femur and this is the uterus. The uterus which is bicornuate uterus. But this is a bicornuate uterus. طيب هنا رجعنا تاني لل HSG. What do you see in this one?
Also distally
abnormal
blocked.
infiltration tube.
Yes, there is a distal blockage in bilateral with hydrosalpinx without spill of contrast, proteinuria spill of contrast. But in this one there is a proximal blockage. حتى البروكسيمال تيوب ما مبينه proximal blockage. لذلك حتى ما ظهرت لنا التيوب عشان نقول في هيدروسالبينكس وكده block the proximal. And also this is a distal blockage with dilated fallopian tube without any peritoneal spill with normal opacification of the uterine cavity in all. يعني ما في أي filling defect، كل الكونتراست عبى كل اليوتراين cavity. لكن فسوى this is شنو؟ blockage, tuber blockage. Also this is HSG. This is a cannula اللي هي connected to the cervix to inject the contrast. What do you see?
Unilateral proximal blockage of
Which side?
the right fallopian tube.
Yeah, the right tube is blocked and there is no clear spill of contrast. What about the left one?
Hydrosalpinx.
Yes, the hydrosalpinx. Do you see any spill of contrast?
And distally blocked.
Yes, it's also it is distally blocked without any spill. السبيل ده لازم يكون متدفق كده الكونتراست فريلي، يعني تحسه موجود بين between the bowel كده. So this is also what is this technique?
Ultrasound.
Ultrasound.
Also can demonstrate the dilated tube. So this is a dilated tube. This is hydrosalpinx by ultrasound. This is hydrosalpinx by HSG. And also you can see this is a hydrosalpinx by MRI. The tubes in both sides bilaterally dilated. Hydrosalpinx by MRI. Like ovarian cyst, very common. يعني very common abnormality. Sometimes this cyst may be a follicular or corpus luteum cyst, and maybe and this cyst easily evaluated by ultrasound or CT or MRI. لكن دائما احنا use ultrasound and you can يعني assess this ovarian cyst very easy by ultrasound. Also can be assessed by CT or MRI. طيب الفوليكولار cyst طبعا عارفينها ايه mostly asymptomatic and بيحصل لها regression spontaneously. اما الكوربس luteal هي الكوربس luteum cyst are most often seen in the first trimester and also usually resolve but maybe rupture or twist sometime. What is this examination?
Ultrasound.
Transvaginal.
Ultrasound.
Yes, transvaginal, transabdominal.
Transabdominal.
transabdominal. طيب ليش transabdominal ultrasound?
Oh wait, no, that's okay.
Yeah.
لا مو filled bladder above it.
Where is the bladder?
ولا that's part of the image above the cyst. ولا that's just normal.
لا ده دي دايما بيكون نورمالي كده يعني
okay.
دي المكان محل يعني ده هي اصلا بتظهر كده ذات لما السنترال فاجينا فدي يعني المنطقه الداخل فيها. So this is a cyst. تسمعوا كلمه cyst كثير فذيس is a cyst اللي زي اللي شفناها في الرينال cyst وكذا. هي بتكون دايما انيكويك، احيانا بيكون عندها وول، احيانا يكون ما عندها وول ليس او ثين وول او ثيك وول. احيانا لازم يكون عندها السيست دائما بيكون عندها posterior posterior what
enhancement.
posterior enhancement. yes. بعد ذاك نعمل لها assessment نشوف هل فيها echoes or no echoes within the cyst. هل نشوف انها في solid component or not، في calcification or not. So this is ovarian cyst. In the ultrasound you can see this is the anechoic cyst without any internal echoes. this is شنو يعني ممكن نسميها simple cyst. دي ممكن نسميها simple cyst يعني not a complex cyst. And also this is a MRI demonstrates this intense or of high signal cyst. This is a cyst in the MRI. So ultrasound, CT and MRI can demonstrate this cyst. طيب احيانا بيكون عندنا patient present with hirsutis, obesity, infertility and irregular menstruation and acne. What do you suspect from this clinical presentation?
PCOS.
يلا
polycystic ovarian.
polycystic ovarian syndrome. طيب polycystic ovarian syndrome عرفت الكلينيكال برزنتيشن hirsutism, obesity, infertility, irregular cycle and acne. And this polycystic ovarian syndrome characterized by multiple cysts, usually more than 10 cysts, and enlarged ovary. الاوفري تكون enlarged. لذلك لما نجي نعمل الترا ساوند او مثلا MRI you can see the ovary اول بتكون bulky or enlarged with multiple cysts. السيست دي بتكون small 1 to 2 مليمتر in the periphery of the periphery. لو مذكرين النورمال ovary كان عندنا ايضا الفوليكلز كانت in the periphery، لكن السايز بتاعها بيكون about 3 to 4 مليمتر. دي بتكون smaller 1 to 2 مليمتر not not less than يعني 10 cyst or more. والاوفري بتكون bulky، دي مهم جدا. الاوفري بتكون large. So this is a feature of polycystic ovarian syndrome can be demonstrated by ultrasound or MRI. يعني in both you can see the ovary is enlarged in large volume ovary with multiple cysts. This cyst أهم شيء برضه هو الرينج in the periphery، وبتشبه لنا شنو string of spiral cysts appearance، يعني string of spiral appearance. This is a feature of polycystic ovarian. لذلك الآن برضه you can see this this is the MRI, this is the urea bladder, and this is the uterus, and this is the ovary. This is the left ovary. You can see there are multiple cysts, small cysts, hyper intense or high signal. الصغار ديل arranged in the located in the periphery. But this is the also feature of polycystic ovary. Do you see these multiple cysts in the left ovary, in the periphery of the ovary?
Yes,
Yes, but this is the polycystic
polycystic ovary.
ovary syndrome. And also this is يعني نفس الشيء this is transvaginal ultrasound. Transvaginal ultrasound. You can see the ovaries bulky ovaries with multiple cysts in the periphery of the ovary with دائما الاستروما بتكون برضه hypericonic with the string of spiral appearance. This is the feature of polycystic ovarian syndrome. اهم شيء تكونوا عارفين clinical presentation. نتكلم شويه عن الاوفريان تيومر. احنا عارفين انه the most common ovarian tumors malignancy the cyst adenoma and cyst adenocarcinoma. These are the most common malignancy in the ovary, cyst adenoma and cyst adenocarcinoma. And in some cases it is not possible to say whether is it this يعني التيومر اذا عندنا ovarian tumor is it benign or malignant. لكن especially if by ultrasound يعني ما ممكن نقول انه this is a malignant or this is a benign by ultrasound feature. لذلك it is you have to do other technique. But by ultrasound you can raise the possibility of malignancy if there is a evidence of invasion of the adjacent structure. يعني إذا لقينا مثلا الاوفري تيومر دي مثلا invading the abdominal wall او كان مثلا invading the ureters او حصل لنا distant metastasis. فدي in this time you can يعني raise the possibility of malignancy. لكن by ultrasound only يعني it is يعني difficult to say this is benign or malignant tumor. Also MRI can be done for more evaluation of the يعني mass ovarian mass يعني to شنو to exclude شنو malignancy. طبعا احيانا بيحصل شنو dissemination of malignancy deposit in the omentum and also ascites may be seen and also peritoneal metastasis also can be seen. But this is raising the possibility of malignancy. Isn't the malignancy usually characterized by omentum deposits or peritoneal metastasis and also ascites. طيب ممكن نعمل ايضا بيت سكان. طيب بيت سكان help us in what?
Metastasis.
Yes,
In grading of the metastasis.
yes to demonstrate the distant metastasis. فلذلك انه لكن ما بنعملها عشان نشوف شنو الاوفري سيلف يعني شنو السيلز ديستنت ميتاستاسيس. ايضا ممكن نعمل طبعا الالترا ساوند ان سي تي ان اديشن تو ذي الكلام اللي قلناه انه الالترا ساوند كان ديمونستريت مثلا اللوكال انفيجن او الديستال سبريد يعني ممكن يكون في ليمف نود او كذا. Also ultrasound and CT and MRI can demonstrate if there is a ureteric obstruction يعني عندنا hydronephrosis او عندنا الليمف نود زي ما قلنا برضه او كان عندنا مثلا metastasis to the liver or the او كان عندنا pleural effusion. All these can be evaluated by CT or MRI and ultrasound. نتكلم شوية عن المورفولوجيكال فيشر اوف benign malignant ovaries. نحن نعرف إن هي is it most likely malignant or benign. فالbenign ovarian mass usually small but the malignant usually large. يعني إذا عندنا mass large usually raising the possibility of malignancy. If there is a cyst with thin wall and no solid component, this is most likely to be benign. لكن in the malignant يكون عندنا يعني of mixed structure بنلقى cystic and solid part. يعني إذا لقينا cystic only no solid, this is most likely benign. يعني this is a feature of benign. لكن presence of cystic and solid part is most likely to be malignant. إذا كان عندنا in the benign, if the solid components are seen and there is no vascularity, this is also raising the possibility of benign. يعني حتى إذا لقينا solid component in the with cystic or there is no vascularity, يعني this is most likely to be benign. لكن الvascularity يعني يكون عندنا mass with vascularity increase يعني with doubler, this is raising the possibility of malignancy. احيانا بنلقى شنو septation within the uterus يعني cyst نلقى فيها septation. Also if this septum is thick and more than 3 mm, most likely to be malignant. And presence of the lesion in both sides bilaterally also most likely to be malignant. And if there is a ascites or peritoneal deposit, also this is the most likely to be metastasis or this is a malignant. What is this examination?
MRI.
This is MRI. Which plane?
Sagittal.
Sagittal. So what do you see? What is أول what is this?
Cyst. Oh.
Bladder.
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 Here. Bladder مش this bladder here.
Maybe cyst.
Yes, cyst ومعاها وهنا عندنا ايش؟ solid.
Solid part. Oh.
Solid. طيب where is this lesion?
In ovary.
In the ovary. So this is a ovarian tumor with cystic and solid component. So
Doctor, how do you know it's in the ovary?
Yes, so it is most likely to be malignant يعني or benign?
Malignant. Since it's
Malignant because it is
solid and cystic.
يعني عندنا both components cystic and solid component. According to this comparison, this is most likely to be malignant اللي هي most likely to be cystic adenocarcinoma. What is this?
Doctor, بس
Yeah.
How do you know it's in the ovaries from that image?
Yeah, from one طبعا section difficult يعني احنا دايما
yeah.
you can follow this شنو يعني اول بتاع يا تعمل سكرولينج طبعا اذا مثلا ما هو طبعا هو اصلا السي تي دي انت بتكون يو كان باي زي شنو ماوس بتعمل سكرولينج بتشوف يعني كل الاستراك مثلا اليوترس يو كان فولو ذا يوترس from مثلا right to left and from the superior to inferior you can follow it and you can see the شنو in coronal زي ما انت قلت difficult from one section انه تعرف انه this is the ovarian tumor لكن هو طبعا نحن بنجيب لك one image لكن انت in the station اذا كنت في السي تي مثلا station you can follow this يعني حتى الليجن دي انت كان you can follow it تعرف الباوندريز بتاعتها تعرف هي extended towards which side وكده لكن فعلا يعني from this one image يعني difficult to say انه this is ovarian tumor. You got me?
Yeah, شكرا.
ايوه. طيب what is this? What is this examination?
CT.
This is CT.
CT scan.
CT scan. What do you see?
Invasion of the tumor to the bladder.
Ovary. Invasion. No. Carcinoma. Ovarian carcinoma maybe. أو
لكن what do you
calcification.
see يعني what do you see أول شيء ده إنه الليجن دي يعني إحنا دايرين يعني أنت you have to describe the lesion.
Mix.
enlargement دكتور.
Yes mix lesion يعني
Tumors.
mix يعني شنو فيها إيش؟
Solid and cystic.
Yes فيها solid and cystic. And what do you الأشياء الهايبر density دي إيش؟ دي
Calcification.
This is a calcification. So this is CT. Show this tumor for part cystic, part solid, with with calcification. So also this is a most likely. What is this type?
Rectum.
Rectum.
What is yes, and what is this?
Urinary bladder.
Urea bladder. But this is a طبعا برضه زي ما قال يوسف الآن انت الا you have to follow this tumor upward and downward عشان تعرف انه the origin of this tumor فعلا من one section كده او من one image هو طبعا difficult لكن this is a يعني شنو ovarian tumor بس اهم شيء تعرف انها شنو how to describe it انه there is a large mass of mixed يعني solid and cystic part with with the calcification حتى عامل لنا pushing to the urea bladder and invading the rectum posteriorly but this is a most likely a malignant malignant appearance may appear malignant. What is this exam or what is this technique?
Ultrasound.
Ultrasound. What do you see?
Cyst.
Yes.
Multiple.
Yes, this is a cyst and this is a cyst. And what is this?
So just solid part.
Yes, this is a solid part. And what is this?
Septum.
Yes, this is a septum. Thank you. This is a septum. So this is a cystic with septum. This is a septum يعني حاجز بين السيست حتى thick يعني وذي solid bar. فإذا كان عندنا septation يعني thick septum with cystic and solid component also this is the most likely to be إيش؟ benign or malignant. Feature of benign or malignant?
Malignant.
Malignant. What is this?
PET scan.
PET scan.
PET scan. طيب what do you see? أول قبل ما what is this?
Stomach. لا. Gallbladder. لا.
Heart.
Yes, this is a heart. Yes, and what is this?
Urinary bladder.
يعني طبعا انتوا عارفين the heart and urinary bladder can show increase uptake normally but there are other lesions are these lesion normal or not؟ يعني في other uptake increase uptake in different areas. شايفين
No, no.
uptake هنا وهنا هنا ده كله increase uptake، كله ده increase uptake. فسو this beta scan demonstrate شنو؟ البيشنت ده كان معروف عنده مثلا this is a known case of ovarian cancer. طيب what is your most likely diagnosis؟
metastasis.
This is a metastasis. This is a metastasis. فزي يصيروا increase أو uptake in the chest, in the abdomen، لكن الموجود in the heart and the urinary bladder is normal. طيب نجي للother lesion uterine fibroid or leiomyoma. This is the most common benign tumor, usually asymptomatic, symptomless, but the patient may present with menorrhagia, يعني excessive cycle or infertility. Sometimes the patient may, like usually it is asymptomatic, and also it may cause a spontaneous miscarriage and postpartum hemorrhage, or the patient may present with huge or distended abdomen, palpable mass. To assess this uterine fibroid or leiomyoma, ultrasound is appropriate imaging technique for assessment of this abnormality. What are these features of leiomyoma on the ultrasound? So this is how to describe this.
Hypoechoic.
Hypoechoic, the shape,
Circular, smooth.
circular,
Oval.
round, yes, oval in shape, hypoechoic in the fundus of the uterus. So usually it is well defined, well circumscribed, hypoechoic solid mass, not cystic. Sometimes بيحصل لنا فيها calcification or cystic changes يعني. This is sometimes. أهم شيء إنها well defined hypoechoic. It can cause mass effect، يعني ممكن تعمل لنا pressure على مثلا ureter، تعمل لنا hydronephrosis and لكن دي not common إلا تكون عندنا huge شنو fibroid. طبعا احنا قلنا ultrasound is the initial and appropriate test for assessment of this leiomyoma. But sometimes you can do MRI if the ultrasound is inconclusive, and it can be done for further assessment of the fibroid before the interventional procedure زي نعمل surgery أو كده. And also this MRI can help us in rule out other differentiate diagnoses. مثلا ممكن نقول شنو malignancy مثلا in the uterus. This is a normal uterus, transvaginal ultrasound, endometrium والmyometrium normal. لكن this is a fibroid. And this is a MRI. You can see this huge intermediate signal lesion in this axial MRI. And this is شنو uterine fibroid. لاحظ أهم شيء إنها هي بتكون شنو well defined، في القالب دي بتكون well defined. And this is MRI sagittal. You can see this is lesion and also this is a lesion. And then two fibroids. This is the first one and this is the second one. So the uterus is large with يعني نقول heterogeneous lesion، يعني عندنا فيها two intensity، فيها black and hyperechoic، فلذلك ممكن نقول heterogeneous lesion. And the inferior one is seen as the area of the cervix. This is the cervix. This is the inferior one, and the superior one حتى عامله لنا pushing to to the bowel. So there is a two fibroids. This is the uterus. لاحظ إنه this is شنو؟ This is the vagina, and this is the cervix, and this is the uterus. This is the endometrial cavity. عندنا two fibroids. The first one and this is the second one. طيب لو تتذكروا المرة اللي فاتت تكلمنا من الحاجات اللي ممكن كان بي كالسيفايد في الليكشر بتاعت الكالسيفيكيشن in the abdomen. One of the calcified lesion is uterine fibroid. But this is a calcification in the uterine fibroid. This is a plain X-ray to demonstrate this calcification in the uterine fibroid. Fibroid can be calcified, which is in this X-ray you can see there are hyperdense أو ممكن نقول opacity or well-defined calcification, well-defined with multiple irregularities. لاحظ الكالسيفيكيشن itself بتكون irregular لكن هي كلها كده is well-defined calcification. But this is a calcified, uterine leiomyoma or fibroid. Other calcification can be seen in dermoid tumor. What are the components of dermoid tumor?
From all of the layers.
Yes.
Fat, soft
Fat.
tissue.
Fat, yes, soft
Hair.
hair, hair,
Teeth.
teeth. يكون calcification لكن بيشبه التي زي ما قلت بالإضافة للsoft tissue. طيب إذا عملنا X-ray, plain X-ray, which one of these components can be seen?
Calcification.
Yes,
The tissue.
hair difficult, soft tissue also difficult, and
Fat.
fat is يعني بيكون difficult برضه لأنه هو بيكون little dark يعني ما بيكون لك difficult to see the fat. لكن the most obvious one is what? Is calcification.
Teeth.
Teeth appearance. But this is X-ray for patient with dermoid tumor. You can see this is the teeth shape. Teeth within the cyst. يعني احنا ما حنشوف السيست ولا حنشوف الفات. حنشوف only the teeth like appearance in the area of the pelvis. But this is نلقى teeth appearance in the pelvis. We are raising the possibility of dermoid tumor. طيب if we do CT, what do you suspect to see?
Fat.
Yes, the fat. How fat appear on CT? Yes, all right. What is the density of fat on CT?
Hypo.
Hypo. Yes, you are right.
Hypodensity.
Hypodensity. حتى قلنا هو negative CT number بيكون black. هو والair. Air and fat both are black لكن the air is more blacker لأنه CT number بتاعه more negative. But this is the fat. لذلك ده الفات. And what is this?
Over.
يعني هو دي كلها dermoid. Yeah, this is a calcification. So this is a calcification and this is a fat, but this is a dermoid cyst. But this is CT demonstrates this, dermoid cyst. عرفنا الكومبوننت اللي ظاهرة لنا كويس ايش الكالسيفيكيشن and the fat. So dermoid tumor is the lesion that يعني contain fat and the calcification and hair and soft tissue and عرفنا كيف نشوف in plain X-ray and on CT. طبعا هي predominantly benign and can be diagnosed by ultrasound. Also ultrasound can demonstrate this. الأشياء دي ممكن نشوفها شنو حتى الكالسيفيكيشن ممكن نشوف السيست itself and also CT and MRI also can be done for assessment of this. But this is ultrasound for the patient. لاحظوا السيست كامل هنشوف السيست هنشوف ايش الكالسيفيكيشن and you can see شنو solid component برضه اللي هي شنو solid component. فإذا this is a dermoid cyst. هي cyst في النهاية لكن في السيست طبعا في الالتراساوند بتكون أوضح فلذلك هنشوف فيها شنو حتى الكالسيفيكيشن بتكون واضحة. بس this is a large tumor with solid component هنا وده الكالسيفيكيشن. this is a dermoid cyst. طيب نتكلم عن carcinoma of the cervix and body of the uterus. The diagnosis of carcinoma of the cervix is normally made by cytology or biopsy and physical examination, not by the imaging. يعني if the patient suspected carcinoma of the cervix يعني the diagnosis here imaging done for confirmation لكن diagnosis يعني clinical by history and physical examination by the مثلا BV and other clinical examination and biopsy and histopathology. Endometrial carcinoma may be suspected by ultrasound زي ما قلنا في الأول في الانترودكشن هناك لما بدينا كان تكلمنا على الاندوميتريال thickening. فإذا endometrial carcinoma قلنا إذا كان عندنا thickening of the endometrial stripe, so you have to exclude endometrial carcinoma. فإذا التراساوند كان يعني by ultrasound you can suspect endometrial carcinoma if there is a widening or thickening of the endometrial stripe. إذا كانت thicken or widen, but this is highly suggestive of endometrial carcinoma. يعني هي بيكون في suspicious. So you have to evaluate this patient more and by the other techniques such as histopathology. ذلك مهم جدا إنه to measure the endometrial stripe and to know يعني the normal range according to the age. MRI also is very useful to assess the extension of the carcinoma of the cervix. يعني هو بيفيدنا إنه كان يعني assess إنه هل الكارسينوما of the cervix دي invading the مثلا local invasion of the مثلا urea bladder or the rectum يعني بتساعدنا كثير في الاشياء دي، اضافه لانه before operation يعني you can assess شنو cervix itself، لانه احنا ذات محتاجين نعرف شنو يعني or other part of the شنو of the uterus especially the cervix. CT also MRI can be able to detect in شنو في dilatation of the uterus in case of the uterine شنو dilatation of the ureters اقصد in case of شنو ureteric obstruction. ده الكلام اللي قلناه في شنو ovarian tumor، لانه احيانا بيكون عندنا huge mass in the cervix causing invasion of the او شنو يعني بتكون invading the شنو the ureters، او احيانا بتكون عامله شنو compression على اليوريتر بتعمل لنا hydronephrosis and hydroureter. What is this examination?
Sagittal MRI.
MRI. طيب what is this?
Spine,
This is a spine. And what is this?
uterus, endometrium,
Yes. And what is this?
rectum,
The rectum. Yes. What abnormality do you see?
enlarged,
Enlarged what?
endometrium.
cervix, tumor in cervix,
والسد.
طيب زي ما قال في tumor in the cervix يعني اللي هو مقصود ده طبعا. عندنا tumor in the cervix. This tumor in the cervix. So this is the cervix raising the possibility of carcinoma of the cervix. زي ما قلت هو الاندوميتريوم ده غايته appear يعني wider، يعني انا ما اعرف البيشن ايج كم وكده، هو appear يعني، لكن انا ما اعرف البيشن ايج. اذا كانت هي بوست مينيبوز غايته هو شنو thicken، لكن the most obvious is this lesion اللي هي شنو lesion اللي شنو in the cervix. Lesion in the cervix. But this is a carcinoma of the cervix. And what is this examination?
MRI,
Transverse MRI,
Transverse MRI. What is this? What is this type?
ovary.
This one.
لا, humerus.
This is a humerus. And what is this?
Urinary bladder,
Yes. And what is this?
uterus,
And what is this?
rectum,
Yes. But this is axial MRI T1 or T2?
T2.
T2,
T2. And you can see there is a mass. There is a mass which is confined to the the cervix. What is this examination?
also MRI, sagittal.
MRI, sagittal. What do you see?
Maybe endometrial is enlarged.
The endometrium. Yes, you are right. The endometrium is enlarged. Endometrium. Just look to the endometrium here. It is enlarged. So, what is most likely diagnosis?
Endometrial cancer.
And also endometrial carcinoma. Although it may be endometrial hyperplasia, لكن you have to exclude endometrial carcinoma. What is this? Also, this is MRI. What is this structure?
Is it
This is
urinary bladder?
the right and this is left. This is area bladder. Yes.
But why is it the other? No, shouldn't it be
Why?
anterior?
Why? Why what?
Why not anterior to the other
What
structures?
is this? What is this section?
Axial?
This is axial. Yes.
sagittal.
Huh? Yes.
No, it's axial. ولا
بس معها ماخوذة axial مع obliquity شوية.
sagittal.
لذلك
أوكي.
ظهر لنا شنو؟ ظهر لنا كده صح في الشيب بتاعي انه اليوريا بلادر يعني تحسبها كأنها شنو؟ مور شنو؟ لأن ماخذين obliquity شوية. لذلك
أها.
اليوريا بلادر يعني ما جات في يعني الانتيرير بارت يعني. ف you can see there the endometrial also شنو؟ lesion. This is endometrial lesion with invasion of the myometrium. So this is a endometrial carcinoma. Well, the next part is very important and ectopic pregnancy. طبعا احنا عارفين احنا بعد يحصل fertilization as the fallopian tube. Sometimes this implantation may be occurred in abnormal position, يعني without the uterus. So this is called, ectopic pregnancy, implantation of fertilized ovum outside of the uterine cavity. What are the clinical presentation? Patient بيجوا بشنو غالبا؟
abdominal pain,
abdominal pain.
amenorrhea, because
Yes, amenorrhea دي أول شيء لابد نحن to suspect ectopic pregnancy لابد يكون عندنا amenorrhea and abdominal pain and vaginal bleeding. طيب عندنا high risk group to develop ectopic pregnancy. الناس اللي بيعملوا شنو؟ in vitro fertilization عندهم more liability to develop ectopic pregnancy, and if the patient have a past history of ectopic pregnancy, this patient يعني more liable to develop again ectopic pregnancy again, and if there is any tubal surgery or tubal maneuver, laparoscopic, also this raising the possibility of ectopic pregnancy. أو patient كعملنا لها tubal ligation، أو in case of pelvic inflammatory disease اللي هو يكون عندنا severe infection. فأول زي ما قلنا احنا اللي عندنا normal intrauterine pregnancy اللي هو الجستيشن الساكن اللي اتكلمنا عنه يكون within the uterus especially in the fundus، بيكون in the fundus، وبعدها بيتكون لنا جواه اليولك ساك وانزل الامبريو. فزي مثلا او ديه جستيشن الساكن زي يوترس دي النورمال، لابد الجستيشن الساكن يكون within the uterus. لكن اذا if the gestation الساك كانت outside of the uterus دي بنقول انها this is ectopic pregnancy. Ultrasound should be done for assessment of the any suspected patient with ectopic pregnancy, and both transabdominal and transvaginal, especially transvaginal is very important because transvaginal is best. لأنه قلنا الريزوليوشن بتكون better، فإذا transvaginal is the best imaging test for assessment of the ectopic pregnancy. طيب نحن متى نقول إنه this is 100% ectopic pregnancy؟ إذا عملنا التراساوند لبيشن متى نقول إنه this is 100% ectopic pregnancy؟ If we see this gestational sac outside of the uterus. هنا خلاص ما في شيء اكثر من كده. هنا اذا لقينا الجستيشنال ساك outside of the uterus، لقيناها مثلا في السيرفيكس او لقيناها في الابدومينال كافيتي او في الادينكسيا في الاوفري، نقول this is a ectopic pregnancy. اذا presence of gestational sac outside of the uterus this is the most reliable sign of ectopic pregnancy. لكن عندنا other sign. اول شيء انه the uterus بيكون empty with thickened endometrial stripe. empty uterine cavity. عشان طبعا اكيد حيكون عندها امنوريا وفاجينال بليدنج ابدومينال بين. نجي نلقى اليوترس empty لكن عندنا الاندوميتريال بيكون thick، ونلقى free fluid in the شنو pouch of Douglas اللي هو الكالدي ساك. although this sign is not a reliable sign او non specific. ليش؟ لانه this free fluid اول ممكن يكون normal مثلا في stages معينه، واحيانا وهي ممكن تكون caused by other مثلا endometriosis can cause pelvic inflammatory disease can cause this free fluid in the Douglas of pouch. لكن اهم شيء نلقى انه شنو empty uterus with thickened endometrial stripe، والبيشنت يكون عندها clinical presentation. additional finding اللي هي دي دائما احنا بنعتمد على انه يكون عندنا adnexal mass. شنو adnexal اللي هو هنا شنو ماس بيكون of cystic and solid part adnexal mass. وعندنا sign بيسميها tuber ring sign اللي هي plop sign اللي هي characterized by echogenic ring surround شنو ectopic pregnancy. اذا اهم شيء عرفنا البيشنت جات ب clinical presentation of the ectopic pregnancy. اذا لقينا الجستيشنال ساك دي outside of the uterus this is 100% in this is ectopic pregnancy. احيانا بنشوف حتى الجستيشنال ساك ونشوف الامبريو ونلقى حتى الهارت بيت. you can see the heart beat يعني demonstrated by شنو دوبلر مثلا. هي نعرف انه this is ectopic pregnancy. الاذر انه نلقى اليوترس يكون شنو empty لكن عندنا شنو الاندوميتريال كافيتي يكون شنو thickened او شنو free fluid in the cul-de-sac or pouch of Douglas or rectouterine pouch. او others additional finding اللي هي يكون عندنا شنو adnexal mass extra ovarian adnexal mass and the tuber ring sign اللي هي زي ما قلنا echogenic ring surrounds شنو unruptured ectopic pregnancy زي دي. فدي البلوب sign. فدي الترانسفاجينال التراساوند. اهم شيء بس تعرفوا بس look to شنو البلوب sign دي اللي هي الراوندد ماس دي بتكون echogenic. فدي بنشوفها في المنطقه بتاعت شنو تحت الاوفريز. اما دي this is transvaginal ultrasound you can see قالوا البيشنت ده هي عندها كان بوزيتيف pregnancy test يعني HCG بوزيتيف. فعملنا this transvaginal ultrasound. what do you see؟
gestational sac.
طبعا هي الصوره ما واضحه. اول شيء this is the uterus and to be oriented this is the uterus زي كده ده اليوترس.
Okay.
No, the switching sack.
Yes, the uterus is empty. There is no
empty uterus.
يعني اليوترس هو بلكي وما فيه شنو ما الجستيشن الساك او في cystic lesion in the adnexial with لاحظوا ده ايش؟ ده الامبريو ذاته ده الفيتال ايكو. This is the fetal echo اللي هو معناتها دي شنو؟ دي gestational sac. This is a gestational sac with fetal echo and this is شنو adnexial mass. فهي الجستيشنال ساك معاها الفيتال ايكو كانت outside of the uterus. اذا عملنا دوبلر هنا ممكن اذا كانت this يعني video still live you can see the شنو the heart beat. اهم شيء انه اليوترس empty without يعني any gestational sac. هنا عندنا cystic lesion in the ovary with the gestational sac an embryo within the gestational sac. فإذا this is شنو؟ دي حتى دي الامنيوتيك فلويد طبعا. This is amniotic fluid within the شنو؟ cystic gestational sac. This is a ectopic pregnancy. The last part about hydatid form, here molar pregnancy, which is a trophoblastic disease, and it is a non-cancerous lesion, can be seen in the uterus. A molar pregnancy start بيحصل طبعا هو fertilization of the ovum، لكن instead of the normal development of the pregnancy بيحصل لنا شنو؟ بلاسنتا بتكون develop لكن ما بيحصل development of the شنو؟ the embryo. طيب أهم شيء نشوف إحنا عندنا two types: partial molar pregnancy and complete molar pregnancy. نشوف how can we differentiate between the two types. Is the partial molar pregnancy our fetal part may be visualized. سموه partial ليه؟ لأن fetal part may be seen. زي دي مثلا fetal part ممكن تشوف الhead، تشوف upper limbs or lower limbs. In addition to that you can see the fetal heart. ممكن تشوف كل patient الفيتس هو شنو live، يعني fetal heart present و amniotic fluid present، لكن characterized by شنو increase placental thickening. هي البلاسنتا بتكون thicken. إذا هو سموه partial ليش؟ لأنه ممكن تشوف شنو الفيتس within the uterine cavity with كل البارت بتاعه كان بي سي، وبالإضافة لشنو بس أهم شيء بيكون شنو البلاسنتا بتكون شنو bulky placenta. bulky placenta. But in the complete لاحظ incomplete بيكون في حتى الفيتال بارت ما بتكون موجودة، بيكون عندنا ecogenic mass زي دي ecogenic mass with cystic area. لاحظ دي كلها cystic area اللي هو cystic spaces بيسموها Swiss cheese or honeycomb or bunch of grape or snowstorm. فدي كلها شنو ecogenic mass، يعني within the uterine cavity بس بيكون عندنا ecogenic mass، يعني ماس هو ابيض ecogenic، لكن فوقه شنو فيه cystic part. كله كده ecogenic mass in the uterine cavity with the شنو this cystic space. زي ما قلنا بسموه شنو Swiss cheese or honeycomb or bunch of grapes or snowstorm. لاحظوا انه compared to the partial هنا كان في amniotic fluid، هنا there is no amniotic fluid and there is no fetal part، واكيد ما في fetal heart tones لانه حتى ما في fetal part ذاتها. so this is called complete molar pregnancy. فالبارشل دي يعني حتى الدياجنوز بتاعه بيكون difficult، يعني لانه ممكن تشوف الفيتال بارت ولا amniotic بس البلاسنتا بتقول very bulky، واحيانا تلقى فيها cyst ذات البلاسنتا بتكون very bulky. لكن الكومبليت مولار بريجنسي بيكون عندنا ليجن كبيره، يعني بالك يوترس with ecogenic mass with interspace cystic lesion. دي كلها cystic lesion no fetal part no amniotic fluid. like this is شنو hydatid mole اللي هو شنو complete hydatid mole. To describe this فهو زي ما قال this pregnant patient present with positive or elevated HCG. لاحظ انه there is intrauterine gestation، يعني هو في gestation لكن with multiple cystic space and ecogenic mass. والappearance بتاعته ممكن اي واحده من ديل snow storm يعني زي العاصفه كده، او bunch of grapes زي عنقود العنب او honeycomb، كل دي can be or Swiss cheese is the appearance of this molar pregnancy. Do you have any comment or any request or any query or any?
دكتور ممكن سؤال؟
Yes, well.
بس اللي هو بالبوليسيستيك اوفاريان سيندروم الام ار اي
Yeah.
اذا ممكن تشرحه مره ثانيه.
MRI مالها؟ يعني
الصوره بس ما فهمت.
الصورة بتاعت الMRI.
ايوه
دي السيست الصغيرة دي كلها، ده الأوفري كامل كده، ده اليوترس، زي يوترس اندوميتريوم، زي ليفت اوفري. لاحظ إنه فيه سيست صغيرة دي arranged the periphery في كل الأوفري.
طب دكتور ليش صورة هيك يعني؟
ليش
يعني
من ناحية؟
ما حاسس مثل يعني مضغوطة أو مثل
صح. هسه ممكن.
بس يعني هي عادي المفروض ما تبين هيك.
لا يعني هسه كان عملت لها كده بتبقى ليك واضحة. صح، هي مضغوط.
اوكي.
حتى انت ممكن انا، ما هو الباوربوينت عندكم يعني هو باور ما PDF فعلا. انا من ساعة
اوكي. لا لا.
انا حاولت اضغطها فعلا كده، لكن هسه اذا انت حولتها كده تبقى لك واضحة فعلا.
صح واضحة. تمام. يعطيك العافية دكتور.
طيب على سريع كده ان شاء الله، بس في تقريب. يا ويلكم.
سؤال، البوليسيستيك اوفرين سيندروم
يا
هي نفسها ستين ليفينثال سيندروم؟
ايش هي نفس ايش؟
يعني هل لها اسم ثاني ولا؟
بوليسيستيك اوفريان سندروم اسم ثاني زي ايش؟
هل في اسم ثاني للبوليسيستيك اوفرين سيندروم؟
No, I don't know. This is the only name that I know. Polycystic ovarian syndrome.
اوكي.
I don't know actually. لكن this is the يعني the famous name or the only name that I know about this abnormality.
طيب دكتور،
Yeah.
آخر سلايد complete molar pregnancy.
Yeah.
إيش يعني molar؟
ده بيسموه الحمل العنبي ولا كيف كده، اللي هو البيشنت بتكون عندها ايمونوريا، وممكن نعمل بريجنسي تيست نلقاه بوزيتيف، حتى نعمل كوانتيتيف HCG نلقاه رايزنج. لكن لما نجي نعمل التراساوند بنلقى انه there is no fetal part. يسموه في ناس بيقولوا داري، هي ناس بيقولوا الحمل الكاذب يعني، او هو بيسموه الحمل العنبي، لأنه الأبيرنس بتاعه بيشبه العنب يعني. لكن هو بيحصل يعني بريجنسي، لكن abnormal بريجنسي. ممكن يحصل يعني نفس السيمتوم، الامونوريا والنوزيا والفوميتنج وكذا، لكن بيكون ما عندنا الويل ديفلوب يعني فيتس. تلقى يعني especially in the complete، لكن in the partial ممكن تلقى يعني البارت الفيتس بارت يعني.
Okay, thank you.
قصدك كذا ولا في سؤال ولا في شيء داخل عليه؟
لا كده صح. Thank you دكتور.
What is this imaging modality?
ultrasound.
Transabdominal, transvaginal.
Transvaginal.
Transvaginal. What is this? For orientation, this is a fundus, and this is the endometrial cavity. يعني this is the superior, this is the fundus, and this is the يعني cervix على هنا كده. And this is posterior, and this is anterior. This is posterior. طيب what is this?
Hyperechoic straight line linear.
Yeah.
IUD.
IUD or IUCD. And this is the space ده بيكون ايش؟ posterior to the uterus, and this is the rectum. The rectum. This is posterior, and this is يعني this is posterior wall of the uterus. معناتها ايش دي المنطقة دي؟
Douglas pouch.
Yes, this is Douglas pouch. Yes. يسموها cul-de-sac or Douglas pouch or rectutrine space. As he mentioned, this is a hyperechoic linear structure in the endometrial cavity. But this is IUCD. What is this? Examination.
CT.
CT.
Axial. What is this?
Urinary bladder.
And what is this?
Uterus.
اليوترس لكن abnormal طبعا مش
Mhm.
حتى كان عامل كونتراست كان بيكون اوضح. and what is this?
Rectum.
Rectum. So this is most likely a carcinoma of the uterus in the cervix, يعني usually most commonly in the cervix. What is this? Exam.
MRI.
MRI, which
Sagittal.
gland? Sagittal. What abnormality do you see?
Enlargement في الاندومتريوم.
Yes, in the endometrium appear bit enlarged. لكن what other striking abnormality?
There's a tumor invading the cervix.
Yes, invading the يعني reaching the cervix.
Recto-uterine.
Yes, and also the megainteruterine and شنو invading what? The rectum. Yes. Invading this is sagittal MRI. You can see this tumor invading the rectum. Invading the rectum. And what is the examination?
MRI.
MRI. You can see this is a. What is this? What do you see?
Septate uterus.
Why septate uterus? Yes, you are right.
Because of the angle.
Yes, angle. How about the angle?
It's acute.
Acute. This is the horn and this is the horn. The angle between the two horns is acute, less than 75. The current obtuse more الانجل هنا يعني between the two horns. The current more كان بيكون أصغر. What is this examination?
MRI.
MRI. T1 or T2?
T2.
T2. What do you see?
The cervical abnormality.
Where is this? يعني here?
No, near the cervix.
Here?
No, anterior to
Above
the.
the
Yes.
above the pelvic bone.
Yes, above the pubic bones, but this is the cervical lesion. Cervical lesion. And what do you see here? لكن here not invading the rectum adjacent tumor. It is confined to the cervix. What about this?
Larger tumor in the cervix.
In the cervix. يعني طبعا احنا دائما بالام ار اي بالذات you have to يعني طبعا ما حتكون عندك one image زي ما قلنا one section or one plane. لابد to comment about the adjacent structure. يعني تقول انه مثلا reaching the مثلا الفاجينا or the cervix or posterior invasion to the مثلا the rectum. إذا كان في invasion to urinary bladder. كل الأشياء دي you have to comment about it. Now in this one, this tumor is invading what?
Invasion in rectum.
The rectum.
In rectum.
The rectum. But this is MRI sagittal invading the rectum. Yes. Is it clear?
Inshallah.
Yes, doctor.
Okay. But if you have no question, thank you for your attendance. Assalamu alaikum.